Joining me on RX Radio today is again the new head of pediatrics at the University of Cape Town, Professor Rudzani Muloiwa. He trained as a pediatrician at the Red Cross War Memorial Children's Hospital. He has an interest in infectious diseases with a special emphasis on vaccine-preventable diseases. Currently, he is an associate professor in the Department of Pediatrics and Child Health at the Faculty of Health Science at the University of Cape Town and runs the Pediatric and Adolescent HIV Clinical Services at Groote Hospital. He is a current member of the Vaccines for Africa initiative, which is located within the School of Public Health and Family Medicine at UCT. Since 2017, Rudzani serves as a member of the South African National Immunization Technical Advisory Groups. Last time we interviewed Professor Muloiwa, he was preparing for his current position as head of pediatrics. Well, Professor, thank you so much for joining us today and welcome back to RX Radio.
Thank you very much, Alex, and greatly appreciated.
So congratulations first off on being appointed as the new head of pediatrics. How's it been in your new position?
Well, thank you very much again for the congratulations, Alex. And I suppose all new roles need, one to kind of settle in and to finally have the full grasp of the job. I suppose for me, fortunately, I'm not new to this department and this hospital, and I have been a member of the pediatrics department.
And now, in your introduction, I mentioned that you've got an interest and a focus in infectious diseases. So for the younger listeners, could you please explain what infectious diseases are?
I think to simplify things, if anyone gets ill or is unwell, there would be different causes. So some illnesses may be due to things that children may have inherited from their parents. It may be due to environmental issues, but a large group of illnesses are due to germs that would cause disease. So the germs will cause an infection, and the infection will lead to an illness or a disease. That's why they're called infectious diseases. So these are things like TB, chickenpox, measles, and even the COVID-19 that we're talking about now. So that is what infectious diseases are.
And then something that comes with these infectious diseases that I mentioned in the introduction were vaccines and immunization. So could you please explain what a vaccine and what immunization is?
It is possible to train the body to know how to identify an infection and how to fight it. And in order to do this, we usually bring a part of a germ to the body so that the body can learn how to identify it, and then by so doing learn also how to fight it. We use only part of the germ or even a full kill germ, and sometimes you can take a full germ which has been weakened so that it cannot cause illness. You bring this to the body in many ways, either by someone can take it in the mouth like happens with the polio, or you inject it, and then the body produces the antibodies to fight this disease. And so that the next time you come across that disease, the body knows how to fight it. And the way of training that body is what we call immunization. And this part of the germ that you bring for the body to know it is what we call a vaccine.
And so in South Africa, are vaccines and immunization available for all South Africans, including those in rural areas?
Yes, all children born in this country, in South Africa, have got access to vaccines wherever they live. It really doesn't matter where they are or whether they are from urban areas or rural areas. All children receive vaccine free of charge because the government supplies that. And that has been the policy in this country for a very long time. So yes.
And now I've heard also that some adults are against vaccines because they're afraid of side effects. What would you say to them?
Well, first, it is possible that a person can get side effects from anything they take, whether it's a vaccine or it's medication. But while it's true that vaccines can cause some sort of side effects, most of these are very, very mild. So vaccines are largely very, very safe. And in fact, apart from giving people clean water, vaccines have been the best tool that we've ever had of improving the health of majority of people in the world. So as I mentioned, the side effects that you usually get from vaccines tend to be quite mild, like maybe feeling some pain in the place where the vaccine was injected, if it was by injection. But most of these side effects are nothing comparable to the benefits that one get by getting full protection against some of the very, very bad infections that we know of.
And talking about some of the bad infections we know of, obviously the world at the moment gripped by the COVID-19 pandemic, and the pandemic's affected the way people access hospitals and clinics, as well as health services that are being provided, and it's impacted many kids that need help because of their chronic condition, getting immunizations, getting their medicine, etc. So how are hospitals going to catch up in providing the normal services that we need?
Alex, it's really true, yeah, that the pandemic has really affected the way we deliver healthcare to people, and in particular children. And so, yes, many children with long-term problems that need ongoing care, and some that need planned operations have not been able to get the help they need. But by and large, hospitals, including Red Cross Children's Hospital, have worked really hard to make up catch-up plans that they are now implementing. And fortunately, there have also been a lot of sponsors who have come to the party and brought extra resources to support some of this catch-up work, so that, for example, operations can be done over weekends, where people from private can help to assist the public hospitals in catching up with some of these things that have fallen off because of COVID. And when it comes to immunization, the Department of Health has put together a catch-up plan. I think it was last week where we saw quite a good detailed program on how to catch up with all the children who may have missed some of their vaccine doses because of COVID-19. So there's been quite a lot of effort to try make up for the gaps that have been created in the healthcare because of COVID, including here at Red Cross, Alex.
And mentioning Red Cross, obviously you've spent a lot of time at Red Cross in your new role, and also, as you said in the past, when you were a registrar. So, what do you think of RX Radio, and do you have any words of encouragement for the children listening?
Well, for me, I think I found RX Radio a really refreshing voice. Quite often children don't actually have a voice, and it's a very, very worrying and troubling concern that children don't actually have a voice. And RX Radio has actually provided this amazing platform that brings forward children's voices so that they actually are heard. And that's why a number of us were very, very happy and pretty chuffed, but really not surprised when children's voices on COVID-19 won that WHO award earlier this year. I would really encourage all our children to actually make use of this so that their voices are heard, because it's those who are affected whose voices ought to be heard, not the ones who necessarily only speak on their behalf. So I would really, really encourage as a platform to be fully utilized in getting those voices heard, which will really impact on what we prioritize as a society in terms of looking after our children.
Professor, thank you so much. It's been great talking to you again this morning, and also getting some more information about immunization and vaccines. Just before I let you go, is there anything else you would like to add?
I just want to say thank you so much for inviting me for this chat today, and to just encourage you to keep up this good work that I mentioned of giving voice to the cares and concerns of our children. Thank you very much.
You are listening to RX Radio.
For and by children.
RX Radio. RX Radio rocks.